So after the check-in process, I will sit down with each patient and go over what your goals are, what your expectations are, what the surgery involves, and what your usual outcome should be like. We'll also spend some time talking about potential issues after surgery, including risks of surgery. I will make sure that all of your questions are answered to the best of my ability and try to give you a good idea or a good sense of what happens during the surgery and what should generally happen after the surgery. After all of your questions are answered, I will turn it over to my staff who will help you through the rest of the process. So the first thing to think about is your goals for surgery. You need to think about what areas you want changed or improved and what you want to talk about. And that way we can prepare adequately and give you the best, most efficient use of your time. The second thing to think about is how to manage your home and work situation after surgery and if it's possible to do so. For example, if you have family members who need extra care at home or your work needs you back in a certain amount of time, you need to think about those things before you engage in the process of having a surgery. Another thing to consider would be medical history. If a patient has a medical issue, they need to think about that before they engage in the process of getting an elective surgery. Certainly if there's something that's serious, you should talk to your primary care physician or whichever physician handles that problem. If you still have questions, you should definitely give us a call and talk to us about it beforehand and see if we can help you through that process. So a consultation with me will usually be somewhere in the neighborhood of 20 to 30 minutes. Of course, that is variable depending on how many things you want to talk about and how complicated they are. The entire process in the office is certainly longer than that, but I try to spend a fair amount of time with my patients, educating them about the process and making sure that we've communicated well and I understand what their desires are. Certainly no patient who comes in for consultation is obligated to have any treatment done whatsoever. Again, our goals here at Patterson Plastic Surgery are to instruct the patients, communicate with the patients, get to know the patients, and see if we can give them what they want.